Welcome back. Well, it's time for our twice-weekly In Focus Health Update.
Joining us now is health reporter Lino Mudu. Hello, Lino.
Hello, Vincent. Hello, Dimiaki.
Yes, your segment today is focusing on cholera, a very deadly disease that often kills.
Definitely, definitely. Right now, a cholera outbreak is threatening the lives of thousands of people in the Democratic Republic of the Congo. The waterborne epidemic has struck South Kivu, the capital of Bukavu province. More than 1,600 cases have been reported since last week. Factors such as poor hygiene and minimal access to safe drinking water contribute to the outbreaks. South Kivu's Governor Marcelin Sichambo has called on local government and international aid agencies to help curb the spread of the disease.
Once again, I thank all our aid partners who have stepped up, and I invite them to work together with the local authorities to find a better way to coordinate all our efforts in order to stop this epidemic.
And in the West African country of Mali, the regions of Timbuktu, Mopti, and Ségou were hit by an outbreak of cholera last August that left 35 people dead. But now a new program is helping locals in Mopti to fight conditions that can lead to the illness.
This is the Mopti region in northern Mali. Cholera swept through this area late last year, killing some people and infecting scores more. The epidemic was likely caused by poor sanitation and lack of clean water. According to the United Nations, almost 2,500 people in West Africa died during this recent outbreak, one of the region's worst. Binta Sow is a midwife in Mopti. Clean water is essential to her work, and a new pilot project that uses solar power to chlorinate water is helping her to do her job.
We have been making chlorinated water since 2009. We don't buy any water from the local market. We clean the rooms, the bathing tables, and we sterilize before injections.
Binta works at Sempara Health Center, one of 10 centers in the Mopti region taking part in the innovative solar chlorination project. So far, the project is proving highly effective. Binta was trained in this simple but potentially life-saving technique by the Malian aid agency Formation Sans Frontières, which means training without borders.
We have initiated this program in order to pass on the electrolyzer concept to other health stations to enable them to produce chlorinated water for themselves.
Local Mayor Boubacar Cissé is a keen supporter of the water project. He says an awareness campaign is needed to highlight the dangers of cholera and simple measures available to keep it at bay.
You know that the Mopti region was subject to a cholera epidemic during the last rainy season. Thanks to the installation of this project, people in our community know how to use chlorinated water, and we haven't had any new cases of cholera.
Each center in the pilot project is equipped with a solar cell, a battery, and an electrolyzer. Chlorine is made when an electric current is passed through salt water. With power from the solar panel outside the clinic window, Binta is able to produce water for her clinic and have some leftover to sell to local villagers.
People also come from the neighboring villages and buy our chlorinated water.
If the pilot project proves to be a success, the program will be extended to rural health stations across Mali. The goal is to teach as many people as possible how this simple technology can mean the difference between life and death.
And for more on cholera, we're joined by Dr. Doyin Oluwole, Director of the Center for Health Policy and Capacity Development at FHI 360, a leading development organization dedicated to improving lives by advancing local solutions. She also has worked with the WHO Regional Office for Africa. Dr. Oluwole, welcome to the show.
Thank you for having me.
We see cholera outbreaks very much in Africa, in countries like DRC. It's recurring. We've seen it in Somalia, in Cameroon. What is going on? First, let me have your take on that. What's going on right now?
In DRC, the growing population in Kinshasa of 8 million people, many of whom are displaced and living in peri-urban areas with infrastructure that is not up to standard, poor sanitation, no safe drinking water, and no personal hygiene information is fueling all of these problems. And also, along the Congo River, as well as the lakes that are within the DRC and its surrounding, like Lake Tanganyika, have been found to be sources of cholera. To date, the WHO estimates that almost 22,000 cases have been reported in the DRC, with 584 deaths, which is about 3% case fatality.
So what needs to be done? Because we've seen, for example, in Mali, people are trying to tackle this issue. What needs to be done in this region, considering it keeps coming back?
Yes, you know, the government is doing something supported with the UN agencies and international non-governmental organizations. But what is important would be enhancing the prevention, preparedness, and response activities. In terms of prevention, it is to provide safe drinking water to the population at large. And right now, the epidemic is already in, but UNICEF is helping to chlorinate water, just as they're doing in Mali. And also, WHO is helping to set up cholera treatment centers and providing training to health workers so that they can treat people correctly. We know that 80% of the cases will recover with just oral rehydration solution. Only a few of them would require intravenous. And oral cholera vaccine is also being given to the most vulnerable. For example, the malnourished, the people in overcrowded areas, in refugee camps, displaced persons, and also to people who live with HIV. But the bottom line is an improvement in the country as well as in the entire continent of our preparedness, prevention, and response activities.
Let me take you to the very basic. How can we understand cholera? We know that some of the symptoms include diarrhea, but can you tell us a little more about this disease?
Cholera is an acute infection of the intestine, the small intestine. It's caused by a bacterium that is called Vibrio cholerae. It leads to large amounts of watery diarrhea. It's very virulent, and it could suddenly lead to death. It depends on the incubation period. By ingesting contaminated food or water, an individual can start, having symptoms within 2 hours, or it could be up to days. The shorter the incubation period, the more virulent it is. And the main cause of death is severe dehydration. But a lot of the deaths can be prevented if individuals have access to oral rehydration solution. And vaccines are available, but we do not want those to preclude us from providing safe drinking water
indeed,
and sanitation
Dr.
to the population.
Thank you so much for your time.
Thank you for having me.
And that was Dr. Olulowe with FHI 360. She's the director of the Center for Health Policy and Capacity Development with the organization.
Well, we thank you, Lenore Madu. Well, be sure to watch for Lenore Madu's health updates every Tuesday and Thursday right here on In Focus.